We were returning from a great trip back to the Bitterroot up in Glacier, and had just turned down onto Highway 35. It was a beautiful clear day and a great day in the Flathead.
I remember spending most of my time looking at the scenery and checking for animals, deer that were coming by, maybe so they wouldn't hit us.
A car had almost sideswiped the side of the stock truck, and my thought was, we're from the Southern California area, and my thought was, so do we have a distracted driver or somebody texting? Never expecting a collision.
Out of the corner of my eye, I could see just the edge of a car, and I heard the sound of a car hitting us, our motorcycle. The next thing I remember is hitting the ground, rolling, and landing on my back, and being in quite a bit of pain.
We got the dispatch saying that there had been an accident, car versus motorcycle, and turned out to be right across from my driveway. I was told that a car had been turning left into Broder Loop and turned directly into the side of a motorcycle and had actually T-boned that motorcycle. So I stepped aside, had the bystanders stay with those two patients while I made a quick call to the hospital. I had to make sure, number one, that alert would be flying to this call.
She told me that they had a helicopter on the way, and I had a background in firefighting and helitack as a teenager, and I remember getting pulled out of fires, and you hear that bird coming and you knew it was going to be okay.
We loaded onto the helicopter, had about a 5-minute lift time, and we're out on the scene within 6 minutes. As we were flying around the top of the scene, it was pretty obvious that it was a involved scene.
Eventually then, when the alert helicopter got here, they landed about 100 feet down that direction.
When I saw Mark Cartwright first, started to kneel down and speak to him to ask him, if he recalled exactly what had happened. And the Big Fork crew told us that he was not Alert's patient, that the other patient was Alert's patient. We made our way over to Kate.
We did a pretty quick survey of her and noticed that she had some pretty significant injuries to her lower extremities and a possibly fractured pelvis as well.
And I remember looking over at my partner Karen and saying, we need to be off this scene now. We need to go.
We were pretty worried for a while. Her blood pressure was pretty low, which was expected with the trauma, but we don't like to see low blood pressure.
As we were taking Kate to the helicopter, her husband Mark did holler out to me, take good care of my wife, and I said, I'll do it, and I'm coming back for you. So as I delivered Kate to the ER, my partner and I did a quick turnaround, which we call a hot turnaround, and we just basically grabbed second packs, all new sets of meds, and hurriedly got back out to our helicopter and headed back out to the scene. So we loaded Mark into the helicopter, and in 7 minutes we're back in the ER. He did get to see his wife briefly before she went to surgery, and I think the total of the entire time from call to the time both were delivered to the ER was about 43 minutes.
What stands out for me is just how professional everyone was. I mean, they talk about us being calm, but they were calm, and they were calming for us because they were very sure of what they were doing.
She actually looked pretty good in a general sense. Her heart rate was a little fast, which could be indicative of blood loss. But as far as the upper part of her body, she did not have any apparent injury. She was talking. She was a very good patient, despite the fact that she had an extremely painful injury.
They made it known to me that it was a level 3 trauma center. One of my thoughts was being from the Bitterroot and knowing sometimes the facilities that might be available in a rural area was a really big concern, and that was just all put to rest.
The first thing I asked, because I knew I had a broken leg, was if they had good orthopedic surgeons. And everyone laughed because of course they know they have wonderful orthopedic surgeons. And they asked if I had any more questions, and I asked if they had good vascular surgeons. Again, yes, they assured me they did. And they were right.
We had Dr. Ben Dykstra here working with us. We called in orthopedic surgeon, Dr. Blasingame, and the associated teams that assist them also came in, and it was a full push to make sure both Mark and his wife were safe.
Unfortunately, we felt that her leg was not salvageable below the knee, and we did a number of things that night, including a primary acute amputation of her lower leg, a external fixator placement on her femur, which was an open injury, quite contaminated, and stabilization, transient or temporary stabilization of her pelvis.
They both knew the severity of their injuries, yet they had no outward signs of fear that we could see. They were very, very strong, which struck us very deeply.
The part that surprised me the very most, and is different than some other trauma cases, was the dedication of these two people to each other.
It was wonderful to hear from them and know that they were going to be okay, and they were both being fit with prosthetics, and that they would be able to go back and live a normal life again.
They couldn't have been better patients. They have amazing strength of character. They were easy to take care of and a delight to take care of. And even in the face of losing their legs, they had a positive attitude. And I got to see them about a year ago when they had prosthetic fits and were walking quite well.
Dr. Blasingame was wonderful with our families and reassured them of our condition and was willing to spend an hour talking to them, telling them how we were and what had been done and what was still going to be done. I remember the nursing staff and the doctors, the therapist, even the food delivery was wonderful. Everyone was so kind and so caring. They had time to hold your hand, to answer your questions.
For everybody there, it's more than just a job. It's what their life and their lifestyle and their dedication to their profession is just, it's a real gift to the community. And the Flathead is truly blessed for that whole community, caregivers and rescue personnel.
I almost didn't make it. Really, it was just a matter of minutes. And so having the alert helicopter is what saved my life. I mean, I know everyone being there on right away and everything they did, but if I hadn't been able to get to the hospital as soon as I did, I wouldn't have made it.